Today, we've got a research-based video that dives deep into a topic that affects millions of people worldwide: high blood pressure, and more importantly, the medications that can sometimes do more harm than good. We'll be exploring 7 blood pressure medications that research has flagged as potentially dangerous due to their side effects or interactions. It's essential to stay informed, so grab a notepad and let's jump right into it. Don't forget to hit that subscribe button and ring the bell so you won't miss any of our insightful health videos. Let's get started. Starting off our list at number 7, we have alpha blockers. Alpha blockers, like doxazosin and prazosin, have long been used to treat hypertension by relaxing blood vessels. However, research and evidence suggest these medications come with notable risks that make them potentially dangerous choices for blood pressure management. The study published in the Journal of the American College of Cardiology revealed that patients on alpha blockers had a higher risk of heart failure compared to those on other antihypertensive medications. Additionally, research from the AlphaDose study indicated that individuals taking alpha blockers experienced a greater incidence of adverse effects, including hypotension and dizziness, than those on alternative treatments. One significant concern is the risk of orthostatic hypotension, a sudden drop in blood pressure upon standing, which can lead to dizziness, lightheadedness, and an increased likelihood of falls. These findings underscore the importance of cautious prescribing and regular monitoring when using alpha blockers for hypertension, as these medications can pose serious risks that require careful management to ensure patient safety. Coming in at number 6, beta blockers. Beta blockers, such as atenolol and metoprolol, have been staples in hypertension treatment for their ability to reduce heart rate and blood pressure. However, research and evidence have pointed to certain risks associated with these medications, classifying them as potentially dangerous for blood pressure management. A meta-analysis published in the Journal of the American Medical Association, JAMA, indicated that beta blockers may be less effective than other antihypertensive drugs in preventing heart-related deaths and cardiovascular events. Furthermore, a study in the European Heart Journal found that beta blockers could increase the risk of new-onset diabetes compared to other antihypertensive medications. Another significant concern is the potential for side effects like fatigue, cold extremities, and depression, which can impact patients' quality of life. Abrupt withdrawal from beta blockers can also lead to a rebound effect, causing a sudden increase in blood pressure or heart rate, as highlighted by research in the Journal of Clinical Hypertension. These findings emphasize the need for careful consideration and monitoring when prescribing beta blockers for hypertension, as they can pose significant risks that require vigilant management to ensure optimal patient outcomes. Number 5 on our list is diuretics. Thiazide diuretics, like hydrochlorothiazide and chlorthalidone, have been commonly prescribed for hypertension due to their ability to reduce blood volume and lower blood pressure. However, research and evidence have highlighted certain risks associated with these medications, categorizing them as potentially dangerous for blood pressure management. The study published in the Journal of the American College of Cardiology found that long-term use of thiazide diuretics was associated with an increased risk of developing diabetes compared to other antihypertensive medications. Additionally, research in the American Journal of Kidney Diseases suggested that thiazide diuretics could lead to electrolyte imbalances, such as low potassium levels, which can result in muscle weakness, irregular heartbeat, and other serious complications. Furthermore, thiazide diuretics may cause frequent urination and dehydration, potentially exacerbating kidney issues and affecting overall electrolyte balance. These findings emphasize the importance of careful monitoring and regular checkups when using thiazide diuretics for hypertension, as they can pose significant risks that require cautious management to ensure patient safety and optimal blood pressure control. At number 4, we have ACE inhibitors. ACE inhibitors such as lisinopril and enalapril have been widely prescribed for hypertension due to their ability to relax blood vessels and lower blood pressure. The study published in the British Medical Journal, BMJ, indicated that ACE inhibitors could increase the risk of angioedema, a severe swelling of the deeper layers of the skin, compared to other antihypertensive drugs. Additionally, research in the Journal of the American College of Cardiology highlighted that ACE inhibitors might lead to elevated blood potassium levels, known as hyperkalemia, which can affect heart rhythm and kidney function. Sliding into number 3, we have alpha-2 receptor agonists. Alpha-2 receptor agonists, such as clonidine and methyldopa, have been utilized for hypertension treatment due to their ability to reduce sympathetic nervous system activity and lower blood pressure. However, research and evidence have highlighted certain risks associated with these medications, categorizing them as potentially dangerous for blood pressure management. A study published in the Journal of Clinical Hypertension found that patients taking alpha-2 receptor agonists experienced a higher incidence of adverse events, including hypotension and dizziness, compared to those on alternative antihypertensive therapies. Additionally, abrupt discontinuation of alpha-2 agonists can lead to rebound hypertension, causing a sudden and dangerous spike in blood pressure, as reported in the American Journal of Medicine. Another significant concern is the potential for these medications to cause drowsiness, dry mouth, and fatigue, affecting patients' daily activities and alertness. Furthermore, alpha-2 receptor agonists may lower heart rate, leading to bradycardia or slow heart rate, and can cause orthostatic hypotension, a sudden drop in blood pressure upon standing, increasing the risk of falls and injuries. These findings emphasize the importance of cautious prescribing, regular monitoring, and gradual dose adjustments when using alpha-2 receptor agonists for hypertension to mitigate these risks and ensure patient safety. Number 2 on our list are calcium channel blockers. Calcium channel blockers, such as amlodipine and diltiazem, have been commonly prescribed for hypertension due to their ability to relax blood vessels and lower blood pressure. However, research and evidence have pointed to certain risks associated with these medications, classifying them as potentially dangerous for blood pressure management. A study published in the Journal of the American College of Cardiology indicated that calcium channel blockers might increase the risk of developing gastrointestinal bleeding compared to other antihypertensive drugs. Additionally, research in the European Heart Journal found that calcium channel blockers could cause peripheral edema or swelling in the legs and ankles, affecting up to 20% of patients, which can lead to discomfort and reduced mobility. Another significant concern is the potential for calcium channel blockers to interact with other medications and substances, including grapefruit juice, which can amplify their effects and lead to dangerously low blood pressure or irregular heart rhythms. Moreover, certain calcium channel blockers can affect liver function, requiring regular monitoring of liver enzymes to prevent potential complications, as highlighted by guidelines from the American College of Gastroenterology. These findings emphasize the importance of careful prescribing, regular monitoring, and patient education when using calcium channel blockers for hypertension to mitigate these risks and ensure patient safety. Number 1 on our list are vasodilators. Vasodilators, such as hydralazine and minoxidil, are medications prescribed to lower blood pressure by relaxing and widening blood vessels. While they can be effective in managing hypertension, research and evidence suggest that these medications come with certain risks that classify them as potentially dangerous for blood pressure treatment. A study published in the Journal of the American College of Cardiology highlighted that vasodilators, particularly minoxidil, may increase the risk of fluid retention, leading to edema or swelling, and can exacerbate heart failure symptoms in susceptible individuals. Additionally, research in the American Journal of Medicine indicated that hydralazine can cause drug-induced lupus, a rare autoimmune disorder, especially with prolonged use. Another significant concern is the potential for vasodilators to cause reflex tachycardia, a rapid heart rate, as the body tries to compensate for the sudden drop in blood pressure. This can increase the workload on the heart and may lead to heart rhythm abnormalities or angina, as reported in the Journal of Clinical Hypertension. Moreover, vasodilators may interact with other medications and substances, including alcohol, which can amplify their effects and lead to dangerously low blood pressure or other adverse reactions. Managing high blood pressure is crucial for your health, but it's essential to be aware of the potential risks associated with certain medications. Remember, every medication has its benefits and risks, and what may be suitable for one person might not be for another. If you found this video helpful, please give it a thumbs up, share it with your friends and family, and don't forget to subscribe for more health tips and information. Stay informed and take care of your health.